His expertise in cardiology and his efforts to promote Indian medicine make him a truly inspiring figure. Sir, it is an honor to have you today. My co host for the evening is Ms. Sana Khan, a clinical nutritionist and the director of growth at Twin Health. Sana, it is always great to see you and great to have you here. Floor is all yours.
Thank you. Thank you, Hiren. Welcome, everybody. Thank you, Dr. Wali, for joining us. And thank you, PlanCover, for organizing this. This is extremely important as we are on the eve of World Hypertension Day, which is tomorrow. And the theme for this year is measure your blood pressure accurately, control it, and live longer. So I think this line in itself would give you an idea how important hypertension or high blood pressure is to your life. Right? Look around you. We're all juggling deadlines, chasing targets, maybe skipping a workout or grabbing a quick bite at our desks. This sounds all too familiar, right? Because today, the life is so fast-paced, and something which is silent, it's often overlooked, can be ticking away. And that is exactly what we are here to talk about, your high blood pressure or hypertension. As we are close on the heels of World Hypertension Day, this is a crucial reminder that this isn't just an older person's problem anymore. For us, the vibrant and ambitious individuals between the age groups of 30 and 45, it's more relevant than you might think. Now, why do I say that? Because hypertension shows no symptoms, earning it the nickname, quote unquote, the silent killer. Yet it significantly increases our risk of serious health issues down the line, from heart attacks and strokes to even kidney problems. Well, to think about it, we are investing so much in our careers, our families, our futures, but are we really investing in our health? That is the question that we urge you to think about. What about, because our health is really the foundation of it all, right? If you have high blood pressure, it can silently erode that foundation. If it goes unchecked, it can impact our energy levels, our focus, ultimately our ability to live life to our fullest. And that's why we're here today. This session isn't just about scare tactics. Anybody would do that. It's about really empowering all of you. We will be demystifying hypertension. We'll try to understand its causes, the risk factors relevant to our age group and lifestyle here in India. More importantly, we'll be exploring practical and actionable steps that we all can take for simple lifestyle adjustments to understand when to seek medical advice to take control of our blood pressure and safeguard our long-term health. So let's use this time wisely. Let's learn, engage, let's commit to making informed choices that will contribute to a healthier and more vibrant future for all of us. I once again welcome you all to this session, and I'm going to take no more time and quickly toss it over to Dr. Wali, because he's the man of the moment and he's going to probably enlighten us all on what is known as hypertension. Thanks, Dr. Wali. The floor is yours.
Thank you very much. Twin team, thank you, Mr. Hiren. Thank you, Jagan, for being here. And our valuable audience, best wishes on World Hypertension Day. And as Sana has rightly said, hypertension is our greatest enemy. And it is a hidden enemy, so we have to talk about it, know the details of our enemy. So I would base my talk on introduction, general approach, common causes of those patients who suffer from hypertension, in which we do not know the cause, especially when you highlighted it can be at any age. So yes, it can be from birth to 18 years of age, and I will show you how it happens. In young adults, it can happen. And it's just not the elderly patients who have hypertension. Sometimes we see blood pressure incorrectly. So most important is to know what is correct way to measure the blood pressure. Many doctors do not know how to tie a cuff, where should be the air tube. Brachial artery is the inner side of the arm. Here should be the tube, as you see. And then stethoscope should be exactly above the artery, and the cuff should be 2 inches higher than the elbow. So I have this video. Every time we talk about hypertension, and this is how our arteries contract and relax with each beat and produce a cardiac output through the blood volume. It is the arterial resistance which is important in genesis of the blood pressure. If flowing blood through the arteries, you can see the three layers of the arteries very clearly, yellow, red, and light red. So how the blood pressure flows, it creates a radial pressure on the arterial wall, and thickness and thinness of the blood also accounts for this pressure. And that is how the blood pressure is generated. So, as I said, patient should be seated for 5 minutes on the chair. Back should be supported. No caffeine, no exercise before that. Obviously, no smoking, no talking with the patient while you are measuring, because these days we have instruments which are voice sensitive. And we should have correct cuff size. Just last night, a patient called, she was restless. And in the morning, I asked, you didn't call me to tell blood pressure? They said the mother was so fat, the doctor did not have the cuff appropriate to the size of her arm, and we did not know what the blood pressure was. So this happens every day. So this is where we should begin. Of course, there is pediatric hypertension also, but on an average, for a common man, he should, at the college age, get the blood pressure measured carefully. And there would be possibility that what we call white coat hypertension. Sometimes at home also reading should be taken, and there are guidelines for it. And there are guidelines now which support. When I was a student, we never supported home measurement of the blood pressure, but now we support home blood pressure. There are occasions when at home and at clinic blood pressure is normal. Sometimes in the night blood pressure rises, or during the activity in the office blood pressure rises. We have ambulatory blood pressure monitors, which are very basic nowadays, and we can put that to know the blood pressure. Despite that, what is the advantage? Ambulatory blood pressure records surges, whether it is morning surge, daytime surge, or nocturnal surge. So now the question comes, what is the average normal blood pressure? 120 and 80. These are the two figures everybody should learn by heart, or not for doctors, but for everybody else other than doctors. And now we have a new entity called pre-hypertension, like you have in your twin program, pre-diabetes. So we have pre-hypertension up to 140, 139 systolic and 89 diastolic. So stage 1 hypertension qualifies between 140 and 159, diastolic 90 to 99, and stage 2 hypertension qualifies more than 160 and more than 100. And these are the various classifications. This is most acceptable. American Heart Association classification is exactly the same, but there is a red line at the bottom which shows higher than 180 is hypertensive urgency, and this should be tackled immediately. There are causes between birth to 12 years, and these are very important causes like congenital kidney disease, coarctation of aorta, which is a very interesting disease. I would show you the video. Renal parenchymal disease due to recurrent infection also. Thyroid disorders. There are disorders of these walls of the artery, which I have just shown you. And there are endocrine disorders in the middle age 40 to 64, including thyroid, that snoring disease, obstructive sleep apnea, Cushing syndrome, and pheochromocytoma. And we can diagnose these causes. You see, unless we know the cause of hypertension, we cannot treat the patient successfully. So we have to know the cause of hypertension. Normally, we do not try to find out the cause of hypertension due to these tests, which are less visible. But for us, it is good to know that we should get some MRIs, we should get echocardiography, computed tomography, Doppler ultrasonography, MRIs, and thyroid scans, thyroid function tests, and renin, aldosterone, and 24 hours catecholamines. So these are the potential contributors and they have to be excluded. Only then we have a right to call this essential hypertension. In fact, during my days when I was a student, we used to label everybody as idiopathic or essential hypertension. And now we know the causes and we can treat them, we can cure them. And this is where it is possible. We can treat obstructive sleep apnea, and commonly we forget to ask these symptoms like flushing, headaches, labile, blood pressure readings, and when a person stands, drop in blood pressure, palpitation, sweating in sit cup. Now, this is what I was talking. The correct cuff size should be important. As you see in this child, it is less broad than what we usually have, 6 to 7 inches. This is 4 inches, or it can be even smaller, 3 inches for a 1 year or 2-year-old child. So we have to rule out kidney disease and coarctation. Now, renal parenchymal disease can occur in children also, because children can get infected, they can get bladder infection, then the infection can travel upwards to the kidney. You can make out in the figure one kidney is large and other kidney is called contracted kidney. This is a kidney which has suffered because of recurrent hypertension or recurrent infections and became smaller. And the top of it, yellow thing, which you are seeing very clearly in this slide, is adrenal gland, which is being supplied by a separate artery. You should appreciate that. Now, how kidney functions. This is a unit of the kidney. And in this unit, the blood goes and blood comes out. And what you see like a jar is glomerulus, which filters these blue and yellow balls. These blue and yellow balls are toxins which form urine. And because of the sudden reduction in the blood pressure or acute infection, these arterial walls contract and they give rise to contracted kidney or sudden cessation of the blood pressure regulator mechanism, and there is resultant hypertension. Similarly, when this phenomena becomes chronic, then what happens to the kidneys is that when there is a chronic insult to the blood flow or recurrent infections, then we have a strain on this glomerulus, which is a unit. We have 1 lakh unit of such glomerulus, which we call as nephrons. You can see the arteries, and through these arteries, blood is constantly going. And if a person develops hypertension, you see these arteries get diseased. Ultimately, they get destroyed. And this is what we call renal parenchymal damage or chronic renal damage. Now, this is very interesting. Coarctation. Coarctation means sudden narrowing. A tube gets narrow. Tube is what it supplies to the whole body, comes out from the heart, and this is called coarctation. Coarctation is a very interesting term which we usually forget to think when we see a patient of high blood pressure and is commonly missed. This coarctation, as mechanically drawn here, could be in the beginning of the aorta, could be in the middle of the aorta, could be in the last part of the arteries. I'll show you how does it look like. This is the heart, 3-dimension, and the aorta coming up with 3 arteries, right and left main arteries, and one other artery going to the one side. This narrowing which you are seeing is coarctation. And this is beautifully shown as a diagram. And this coarctation causes hypertension because of ischemia. When we do X-ray of such patients, we see 3 arrows depicting sign of 3. One is the pre-coarctation segment, which gets, due to whirling currents, dilated, and the other segment is narrowed, that is blue arrow. And on the ribs, these collateral arteries which get enlarged, what you see here as a spiral coils, they leave a mark on the ribs, which are the ribs marking us called Rosler's sign. This is what is academic thing, but it's very interesting to know these names sometimes. So when we do angiogram, we can see the narrowing after the coarctation, which is shown here as a light color, and pre-coarctation eddy currents leading to dilatation. So echocardiography is sufficient for the diagnosis, and then we cover one major site. Now, the second interesting disease is Takayasu arthritis. The name is Japanese, but it is very common in India. Then we have thyroid dysfunction, fibromuscular dysplasia, renal parenchymal disease. Because the time permits, I will see a line about each. And in India, Takayasu's disease is most common cause of renal vascular hypertension. And because of this, we have more cases in ladies, common in India, China, Korea, and some part of Japan. So this is a drawing which shows where all places we have to see, like we should see the pulse, we should see according to age, the hemodynamics, we should auscultate the heart. This is how it gives a clue. And there are many clinical features which are standard, and they have to be, these fill in the blanks have to be uh, appropriately filled up. And most of the research on Takayasu disease is done at Chandigarh, and one of my friends has done at GB Pant Hospital and also in Mumbai. So these are GSB Medical College, Grand Medical College, Bombay, KEM Hospital, Parallel Mumbai, and at GB Pant Hospital, and also at PGI Chandigarh. And what we have found out that this is the very high percentage we miss all the time. This is a vascular disease, and the cause remains enigmatic, and most of the cases are tubercular in India. And this is very important part of it. We have etiology as tubercular arthritis, and that is where we can treat this before it becomes a permanent disability. And we have arteries. If we take the biopsy of peripheral artery, the basic pathology is lumen gets compressed. So the less blood flows to the kidney, less blood flows to the organs, and more blood remains in the heart. So heart gets enlarged, heart gets hypermuscular, what we call left ventricular hypertrophy. And when we see with the modern gadgets, these arteries have some well-named sign like Macron's sign. And when we do ultrasound Doppler, the arterial narrowing can be appreciated. Now, there is another disease in which renal artery by birth can get compressed, as the red arrow points out. When the less blood goes to the kidney, it becomes shrunken kidney. And when I was in Mayo Clinic, they told me a very important part of renal artery disease. We presumed that because of shrunken kidney, there is hypertension, chemical hypertension. But they told the shrunken kidney has less requirement of the blood, and this does not cause hypertension. It is the mechanics of hypertension, which I'm going to explain in the few next slides. And this is the sign, what we see in Doppler as a halo sign. This is all for academic reasons. Now, what chemical changes take place? You see, angiotensin converting enzyme is very important enzyme which gets converted, and it's converted into angiotensin 1, then angiotensin 2. This controls oxidative stress on various organs, including kidney, arteries, heart, and brain. So when this angiotensin converting enzyme gives rise to vasoconstriction by angiotensin 1 receptor blockage, angiotensin 1 receptor binding, then there is vasoconstriction, and ultimate result is hypertension. Then we have got endocrine causes. Endocrine causes means adrenal gland, which I had just shown you as yellow. It can also secrete hypertension secreting adrenaline-like hormones. And this is also very common in youngsters, sometimes missed. And the only feature of this hypertension by which it can be caught, that most of the time blood pressure is normal, sometimes it is very high, 200 by 100, other days 150, 90, 120, 80. Then there is another disease of the blood vessels itself, because blood vessels, these are the sleeves of the body for circulation. They get disease, and the fibromuscular dysplasia is the muscular part of the vessels. Then the whole organ, including kidney, gets destroyed like this. You can see the destroyed kidney because of it is not narrowing like you saw the last arrow. This is the normal artery, but the arterial lumen gets disease, so the kidney is destroyed, shrunken kidney, like this. Dysplasia means it is not blocked, it is irregular. And this is how it looks like on angiograms of the kidney. Then we have some tests to do to confirm fibromuscular dysplasia. This is a very important slide, which shows the genesis of the coarctation. These are the three layers of the artery which get weak. The middle layer sometimes gets weak, and then it gets expanded. Like you can see this expanded area showing fusiform dilatation of the aorta, and that is how it gets damaged, and the aorta gets fusiform in shape, and this causes change in the dynamics of the blood flow and reduction in the supply. Sometimes this gets ruptured also. I would quickly pass through this slide, but I will show you how the aorta which gets dissected. This is where we can see the dilated aorta, narrowed aorta, and this is diseased aorta, and this is called aneurysm. And this gets ruptured. It is very important to know how all these things happen in the human body and how the body behaves with this, and body tries to protect it. See these hexagons. This is the internal layer of the tube. This gets ruptured. The blood starts flowing in between the middle layer and the internal layer. So this makes a false passage. And how this makes a false passage? The blood starts going into two linear segments and creates a septum. That means artificial lumen. And when this happens, this can rupture like this, and it can lead to sudden death. And nobody knows what's happening inside. So it is very important to diagnose. Then comes the thyroid. Thyroid disorders in females can be a cause of a difficult to treat hypertension. We have an entity known as difficult to treat hypertension. Previously, we used to call it resistant hypertension. But now we have classified this into two, difficult to treat and resistant hypertension. So thyroid dysfunction, both hypo or hyperthyroid can cause hypertension, and we have to diagnose that with simple test. Then there are other reasons like ladies taking oral contraceptives. There are herbal pills people take for stimulation like ginseng. There is the use of illicit drug substances like amphetamine and cocaine. These are the things which patient will never tell us that he is taking this. Or a very common thing like steroid, or some psychiatric drugs, or even some diet pills, or sometimes constipation relieving pills, which have all salt retaining properties. Now, one of the very important homely reason to have hypertension is snoring. Previously, we used to ignore snoring, but now it is a definite syndrome, and this is called obstructive sleep apnea. It leads to congestion of the posterior part of the throat, causing less oxygen delivery to the body, and therefore causing ischemia, increased NO, antioxidant effect, and therefore reduction of the blood supply, and therefore causing hypertension. Now, there is another mechanism which controls body's blood pressure. There are receptors in our neck here. And this is a reason why if you continuously massage your neck for some minutes, patient can even have reduced heart rate and die. Now, these receptors also control blood pressure, and they give a signal to the brain to constrict or to dilate the arteries. So these baroreceptors are very important in the genesis of hypertension. And we have devised certain pacemaker-like things which can block these baroreceptors for treating difficult to treat hypertension. Same way, we have devised certain electronic electrodes which can denerve the kidney, because when the kidney becomes hyperexcited, it produces renin and angiotensin. To block this kidney, we can continuously stimulate the kidney by small voltage current, and this is called a renal denervation. This is how it is done. A catheter is passed through the vein in the leg, and we put the electrodes in the kidney, and they discharge less than 12 volt millivolt current and day plus. So overall, we have so many causes before we go to say that hypertension is a disease which we cannot treat. We can have yoga. Very important thing which we doctors don't talk usually. We talk about drugs, we talk about difficult things, we talk about surgeries. And most important thing is to regulate the human body. The human body can be regulated by various things. Exercise is one of the important things. And these days, our Prime Minister is supporting a lot. I was there when he launched the International Yoga Day. And yoga is answer to many problems, day-to-day life, because of his stress, because something what we need to control our body systems. Hypertension is indiscipline of the body. We can discipline the body by exercise, by correct eating, by quitting smoking, quitting alcohol, and doing yoga. And your program is directed towards making the body disciplined. And I think some slides are coming. These are the slides which Sana would like to take over. And I think if there are questions, I can answer them. And I'm on the line. So Sana can take over.
I'll just take 2 minutes. Thank you so much, Dr. Wali. Though, many of the things were slightly technical for us to understand, but I'm going to ask you, there are a couple of questions that we have. I'm going to pose them for you. We'll help our audience, and I would encourage you all to please send us more questions, because you'll really be getting all your answers over the next couple of minutes. So as Dr. Wali has mentioned, we at Twin Health, our main aim is to reverse all chronic metabolic conditions, and hypertension is one of those chronic metabolic conditions. You can completely reverse it. You can leave your medication for high blood pressure and other chronic metabolic conditions. What we do is basically, as the doctor has rightly pointed out, we need to regulate our sleep, breathing, our eating, and our activity. The moment we have all these things in sync, we are able to normalize our dysfunctional metabolism, which is the primary cause in most cases than not, the reason for high blood pressure. And we have had people who have subscribed to the program and who have benefited in terms of leaving their medication, which they thought they had to take for life for high blood pressure. It's really simple. Because it's a lifestyle disease, so to speak, changes in your lifestyle are what's required to get there. So in the digital twin health program, we create a digital replica of each individual's metabolism by taking certain sensor data, which amounts to 3,000 data points in a day, which includes all that you see on your screen. What is the kind of sleep you're getting? What is the food you're eating? What are the medications? What is your activity level? Are you experiencing any symptoms? Where are you living? What is the weather like? What are your stress conditions? How much are you traveling? So all these factors are taken into account and your digital twin is built. And then from there on, we try and give you precision recommendations to be able to correct your metabolism. Doctor, can you move to the next slide, please? Yes, and all of this is scientifically backed. As you will see, journal JACC is the authority when we talk about hypertension, when we talk about the scientific papers that come out. And Twin Health is proud to say that our randomized controlled trials and the results from that has been published in the Journal of American College of Cardiology. And we have also had backing from the American Diabetes Association, because we also reverse conditions like type 2 diabetes, fatty liver, high cholesterol and high blood pressure. So these are the results of the trials where we see people actually coming out of their condition and achieving great results without any sort of intervention from medication. And the last slide now, we can see these are the results that have been published in the journal, which talk about how out of 319 participants, the group achieved significant reduction in the systolic blood pressure. And this is after 1 year of being in the program. At least 50% of the people have been known to completely live without any sort of high blood pressure. So that's just a gist that, yes, Solutions are there. You don't have to be dependent only on medication. These days, artificial intelligence and science has advanced to such a degree that these conditions, I'm not calling them diseases, have we've achieved so much progress that these conditions which we thought were for life, they can now be controlled by eating right, sleeping right, and doing the right kind of activity, and by relieving all the stress that we all face. So yes. I'm going to take these three questions and we then have a simple quiz which we are going to put to you to understand how much you already know about hypertension. One attendee asks Dr. Wali, if someone has only one kidney, are they a potential case for being hypertensive later in life?
Not at all. We donate kidney. Usually the person who donates kidney does not become hypertensive at all. Rather, the other kidney grows in size. You have seen the kidney can shrink due to the less blood supply, but when you have a normal kidney and you have the supply directed to that normal kidney, this normal kidney takes the function of the other kidney and becomes enlarged and delivers the best. For life, we require 1/6 of two kidneys. That is 1/3 kidney to remain alive. So one can donate more than one kidney.
Okay.
So this is very interesting. Nature has given us so much reserve, but how we spoil this reserve is very significant. It keeps happening. I have shown these technical conditions for the benefit of patients also. And these all conditions which I have shown only cause 4 to 5% cases of high blood pressure. Rest 95% cases of hypertension do not have these causes. And we miss these causes. If we miss these causes, twin program or any program cannot help. So my purpose was to show that majority of the people walking with hypertension can be attacked rightly, or this fatal disease, silent killer, by right kind of methods other than medicine. I'll give you one example. Today, one of my friends, Sana knows Dr. Rakesh Sharma. He's a very senior and very, very renowned pathologist. He's under my care for last 30 years, my class fellow also. Now, today he calls, Dr. Wali, my blood pressure has gone down to 90/50. And 3 weeks back, he told that for last 2 months, he's on a regular exercise program. I said, Rakesh, this is good news for you. You have to reduce your medicine and be without medicine for a few weeks and see how much improvement you have done with your exercise. So this was only one thing which he has changed. He started exercise regularly with the help of a tutor, and very regularly he's doing, and his blood pressure medication has come to a halt. I had to say that to please stop the medicine, which you are just taking one tablet a day. Of course, two medicines in that tablet. So one kidney, no problem. You donate one kidney, no problem. If one kidney is diseased, then there can be problems. So you have to prevent kidney function, not the kidney's existence. Both kidneys can exist with disease due to recurrent infections. Stones, I have not told, stones are also very common cause of hypertension in India. Renal cysts, in ladies, recurrent E. coli infections, they cause contracted kidney. And then it becomes very difficult to treat. So when you follow twin program, you also learn hygiene, how to remain hygienic to prevent various diseases. So this is very important aspect. And this, what we have shown in this last slide, was a work done by very prominent doctors, and they are all international doctors. And they have proved that this program can benefit diabetes, hypertension, obesity, and fatty liver. All these conditions can coexist together. And in India, this has become an epidemic because of the wrong kind of food, smoking, alcohol, and sleep patterns being disturbed, and unnecessary stress.
Absolutely. I have many questions are coming in, Dr. Wali. Another, attendee asks, if my report says BP and CT scan shows thickening of heart vessels, is it reversible? If my BP is controlled, will the heart vessels thickening reverse?
Every day I see that. I have showed it that is why I showed that video. When you put more pressure on the artery, it becomes more muscular, like you make your biceps. So arteries also have biceps-like muscles, which we call as smooth muscles. The more pressure you put right in the beginning, the third slide, which I have shown, that when the pressure, blood passes through the arterial lumen with pressure, it causes damage, overstretching, and thickening of the arteries. If this thickening is muscular due to high blood pressure, and if your blood pressure is controlled, the answer you know, it will go. But if this thickening is because of cholesterol deposits or due to the disease of the artery, you have to control your cholesterol through the disciplined diet program given by the twin-like programs.
Right.
So twin program is answer to both of these conditions, your resistance to the arterial wall and to the thickening of the arterial wall, which gradually improves. You see, previously it was believed that once the cholesterol deposits in the arteries, it cannot be removed. At that time, we didn't have those good drugs. But now it has been seen that this plaque can be reduced. And as we exercise, this plaque becomes part of the elastic blood vessel. It does not get dislodged. So both ways this program can be helpful. It makes the plaque stable as well as can make the plaque smaller. And we don't do the follow-up angiography, so we don't talk about it. That is my problem. After stenting, nobody goes for repeat angiography. After bypass, nobody goes for repeat angiography. Normally, unless you have symptoms. So, after we treat medical condition by surgery or by stenting, it is our duty to follow and do regular exercise and make our arteries pliable, elastic, and healthy.
And to keep going back and doing your diagnostic tests at regular intervals. That's good to be aware of where you're at. Another very important question that we haven't touched upon, but is very common, is low blood pressure. So somebody is asking, what is causing low blood pressure?
First of all, there is no blood pressure as low blood pressure. I have told just now that my doctor was telling me BP is 90 by 50, is continuing his exercise. So low blood pressure only occurs when you lose blood, you lose water, you lose the vascular tone. That can happen in a condition when you have severe diarrhea, severe dehydration, shrinking of the blood volume due to bleeding, massive bleeding, then you can have low blood pressure. That is called hypertension or cardiogenic shock. Then low blood pressure can also occur when you have overdose of high blood pressure medicines. So that is we create. Then low blood pressure can happen sometimes when you stand suddenly in lying position, your blood pressure is stabilized. So when you suddenly make the bottle upright, the bottle was lying and filled till the cap, to make the bottle vertical and it is half filled. So blood pressure becomes low like that and can have symptoms. Blood pressure per se does not cause, low blood pressure per se does not cause any symptoms if it is gradually adjusted. Due to the sudden loss of blood, sudden loss of fluid, and shrinkage of the blood volume or cardiac failure, weak heart pump, it can become low blood pressure. But patient can walk, patient can talk.
But
It is
doctor,
not.
in some cases, they say that having black coffee or having salt, with water can help with low blood pressure. Is that?
This is a physiological low blood pressure in which salt and coffee stimulants can help. Even water can help. Salted water can help. But there is a caution. What I was remembering in the answer was that these days children are consuming a lot of stimulant drinks which have excess caffeine than mentioned on these cans. And they can be a precursor to starting from low blood pressure to high blood pressure and even the craving for alcohol. So these type of things should be avoided. I have mentioned that stimulants like drugs or some agents can cause hypertension. So youngsters have started consuming some stimulants, so which are also not good. Low blood pressure treatment is increase of blood volume. And if low blood pressure is without any symptom, it's a sign of health, not a sign of disease. Mind my words. There is no disease like low blood pressure except those conditions which I have mentioned. It is better to have low blood pressure. Now the dictum is lowest is the best. So keep the blood pressure as low as it does not produce symptoms. It can be 90/50. Many ladies, when I was a student, when I went from male ward to female ward, was showing the blood pressure readings like 100/70, 90/50. And I went to my head of the department. Sir, madam, all the ladies have got low blood pressure. And then she explained me right in the third year that ladies have like this blood pressure. Don't get worried. You have come from a male ward where the normal was 140/90 or 130/80. So this is a physiological thing. It's not a disease. And lower blood pressure is, to have lower blood pressure, that means you have more blood pressure reserve. You can
Right.
talk, you can shout, and you can increase the blood pressure. So you have a safe margin. Don't have the brain hemorrhage.
Somebody asked, can we cure snoring issue completely?
Kindly repeat.
Can we cure snoring issue, snoring completely?
Yeah, snoring is treated, cured. It's a big thing these days. Obstructive sleep apnea, if it is caused by the drooling of tongue behind, it can be surgically corrected. Some people have very low posterior part of the throat, and when they lie straight, the tongue dips in, so we can do surgery. Some people have very narrow nasal passage. We can do repair. In children, we have adenoids, balls behind the posterior part of the nose. That can be removed. So it is curable. Then, most important thing which student can do, you have to reduce obesity. It can be curable. Even then, if it is not relieved or patient has symptoms, we have machines like BiPAP, CPAP, but they are the last resort. And unless a patient determines that he has to reduce weight through an effective program, it cannot be cured. Many people have bought machines, many clients, many patients of mine, but they are of no good use because they do not shed their weight. So obstructive sleep apnea is a treatable entity, and yes, if it is because of obesity, it can be cured.
Thank you, doctor. Somebody is asking me about the twin program. I have left my number with you. You can get in touch with me and we can talk about the details. It's a subscription-based program. What we do is, and we, give you a personal coach, a doctor, 5 blood works at regular intervals, and we also give you certain non-invasive sensors. And we use all of these things to basically optimize your metabolism. So you know exactly what should you eat, are you sleeping well, what should be your nutrition at a specific time of the day, how much activity level is suiting you. So all those details, and somebody is there to constantly monitor you. So we can discuss about these details. I've shared my number with you. Anybody else, you can actually put your questions here or maybe unmute and ask if that suits you. So how should we know, doctor, since you're here, that I have high blood pressure? For somebody who is completely ignorant about it, because it's silent and it's difficult to know. I mean, how can we know before it's too late?
This is a real tragedy. We never get blood pressure checked regularly. Some children lose their kidneys when they have really hypertension, and nobody suspects. I have made a survey about 20 years back. When I was in Rashtrapati Bhavan, I went to my children's school, and it's a class of affluent children. 50% of the obese in the class, that means in a class of 55 children, had high blood pressure. Definitely, we documented it, and we told their parents. All of the children who had hypertension, their parents had hypertension. So if the parents have hypertension, it is the duty of the school teachers or school administration to add a column in their application. Does anybody in your family has high blood pressure? and even we can make a mention of diabetes. So if that is the case, is all children going to school should be monitored once in 5 years, even without having any symptoms or anything. Those who have a family history, once at the age of 5 years, then 15 years, then as I showed first slide, 18 years, and then at college going, they should be checked blood pressure. They should make a routine. You see, we can save thousands of lives. We can save thousands of lives by monitoring this simple blood pressure, which does not cost a single penny. And this is not being done. I am very sorry to say that some specialized doctors, like ENT doctors, most of the surgeons, when the patient goes to them, don't check the blood pressure and they lose their patient sometimes. When the patient goes to anesthetist before the surgery, immediately before the surgery, the anesthetist finds blood pressure is 180/100. The surgeon loses the case for that day, sends the patient back to physicians, and we treat the blood pressure, and then the patient gets operated. So if a surgeon would see the blood pressure, there is no harm in seeing blood pressure. It takes only 2 minutes. Then many things can be drawn online, in line, correctly. So every doctor, every paramedical should know how to take blood pressure. In a class, in a good school, there is always a nurse-like staff. Once in a while, every class students can go in recess interval and get the blood pressure. It's a fun to let BP check for children. But we never do it. That's the problem.
So basically, you're saying we have to start young, monitoring BP, make it a habit, like we go for blood tests for children or we go for regular doctor visits. Because when we take our children also, or if we are like office going people, if we go to a physician for a normal checkup, it's not often that we see blood pressure being checked. You're saying that should be the standard operating procedure, right? SOP. When you enter a hospital, when you enter a clinic, first the BP should be checked. Sugar levels should be checked before proceeding with other tests. So early diagnosis can happen at home. Thank you so much. So one attendee asked Dr. Wali, why do we hear of people being fit? Meaning people who are going to gym, people who are absolutely fit. They've gone for master health checkups only maybe 1 month ago. They don't have any hypertension, but they're still dying. Recently, some startup founder who had no BP and was super active died of a heart attack.
Sad question, sad answer. It's a young cardiac death. There can be sudden cardiac death without a cardiac disease. This is one of the things which can be in the genes, which can happen to anyone. And when I was giving one of the answers, I told that there can be plaque, the plaque can rupture. And one of the methods of making this plaque stable is exercise. This happens, and this very commonly happens. And I have patients coming with very abnormal ECGs, and we treat them within minutes. Like this ECG, you can make some outlines. I have another one, which I'll show you in a minute.
Actually,
So this patient, yeah, I let me show you this ECG. Answer to question is an arrhythmia like this. This is a heart rate of 240, and this is a walking patient, and this either to be treated by electric DC shock or by a medication immediately. Otherwise, this patient will die. If this patient is walking on the road, he will die. If you treat, the ECG becomes normal within 5 minutes. This happens to my clinic once in a while every week. So we have to catch them when they have arrhythmias. When they have arrhythmias, then they can be detected. Some of these conditions are genetic and they are fancifully named, like what you call Barguada syndrome. This is an ECG issue. And we have some syndrome like what we call long QT interval syndrome. And these are the abnormalities we can detect, like this case was saved 5 minutes after ECG shows this. So this can happen to a walking patient and can have sudden death. Arrhythmia is one of the very, very common cause of sudden cardiac death. Then I was talking about softening of the plaque by exercise. So if this is a hard plaque, it can just go, I give example of गेंद पतनाले में फंस गई, ball in the narrow patnala. So this behaves like embolus, and it behaves to leads to sudden obstruction of the supply to the heart muscle and sudden death. Of course, players dying in the field, we lost certain players during field, and Damar Hamlin, while playing, he got stuck at the chest and the cardiac rate stopped. So this is another condition which is called cardiac concussion, concussiocardia. This can happen as a sudden injury to an expanding heart while in a diastole without any disease. He is playing, he is running in the field, but a sudden jerk on the heart can lead to an arrhythmia or something due to which heart suddenly stops. The player has ambulance at his disposal, player has doctor at his disposal, cannot be saved later. So this is called commotio cordis or cardiac concussion. Then there are causes which are very, very rare, which can happen because of genetic conditions, because of cardiac muscle disease. There is a healthy heart, which is called hypertrophic obstructive cardiomyopathy, which is called athlete's heart. And this heart becomes hypertrophic in the muscles. The cardiac muscles, their thickness increases. This thickness of the cardiac muscle, which you are seeing here, this thickness suddenly increases near the valve, this valve, and obstructs, creates like choking of the neck situation. So the blood circulation gets choked. So this is in a healthy heart, this happens. And this is called hypertrophic cardiomyopathy.
Okay.
Dilated heart can also cause sudden cardiac death. But most of the time, it is this electrical dysrhythmia, what we call arrhythmia. This is named as ventricular tachycardia. This is the most common electrical cause of cardiac death. And this should be treated either by, thank God you asked this question, we have to organize cardiac defibrillator at public places, at hospital receptions, at hotel receptions, and we have to teach the people CPR. And these two things can save many lives.
Right. Another question, we have two more questions, doctor. What is the correct time to go for an angiogram test?
These days, angiographies are done very commonly, and rightly so. When you have an unexplained chest pain, angiogram is done when we verify that we have a cardiac flow blockage. If we do in every chest pain, this is wrong. If we miss chest pain and not do angiogram, it is wrong. So we have to identify the cases carefully, who have a family history, who have high blood pressure, who have increased cholesterol, who have pain in chest, very typical as described, walking uphill, relieved by sitting, relieved by sorbitrate-like medicines, radiating to the left arm, radiating to the back, radiating to the jaw, recorded in ECG. Nowadays, ECG used to be the ultimate for diagnosis, but now angiogram is the gold standard test. Before that, we must do a treadmill test. In emergency, of course, we have to do angiography. But in a definite case of chest pain, which a doctor can make, it is due to heart, angiography should be done. Otherwise, angiography should not be encouraged. We have other tests like treadmill tests, like we have myocardial perfusion scan, we have echography, echocardiography, we have CT angiograms. So it should be staged investigation, not that everybody should be recommended angiographies, which is being misused these days. So I have balanced my answer by saying that a careful selection of patients need angiogram and can be life-saving.
So what is that first test, doctor, which is very inexpensive, but also gives us a fair idea of how our heart is doing at the moment? Let's say a person has no hypertension at the moment, but is going for a regular checkup, say, I want to do my heart test, or maybe the BP is slightly elevated. So should an ECG be okay?
No, only ECG will not tell. Despite normal ECG, one can have a heart disease. Treadmill test is a very good test, which is safe and which is controlled by a doctor. Normally, treadmill tests in hospital are done by nurses, even in America. But no, treadmill test is a very, very sensitive test. It should be done at least in presence of doctor and can be controlled. We have a stop button. Stop when we know that there are changes coming. So treadmill test is a very safe test, very important test, can be repeated any number of times, inexpensive, and tells a clear-cut picture of the cardiac function. And if there is ischemic heart disease or if the patient has got blockage, it can show up in the ECG tracing. It cannot be changed. It's not observable dependent test like echocardiogram. It is a definite documentation of a heart disease, short of which we can do ECG. We used to do master's test. We had steps in the consultant's room, and the patient would go step 5 times and repeat the ECG and see the ECG changes. Very simple, but very informative. The best test is patient symptom. If the patient is rightly describing me, I can diagnose it as angina. Sometimes there is a reverse of it. We have a cardiac pain, we misdiagnose it as a gastric pain, we give the patient anti-gas injection, send him back, midnight he dies. So this should not happen.
Okay.
So we should have other markers to confirm that this is a cardiac pain, like blood troponin marker, ECG, repeat ECG. I used to laugh when I joined Delhi. My boss used to do ECG when the VIP patients were coming and the VIP patients going. And I used to think, what is this? One is coming ECG, one is going. No, that has a great logic. He used to do some exercise in the room with master's test and repeat the ECG. And this was very confirmatory. So what we call this today is dynamic changes.
Right. Right. So TMT is something which should be looked at.
Yeah, very seriously. It is very informative, inexpensive, supervised by the doctor, controlled test. We can stop the test and then we can send the patient to the angiography.
Got it. So basically, do not have to get very scared when we step into the hospital, because generally what happens is a long list of tests is prescribed.
No need, no need.
And yeah, so TMT should be good enough. Next question is quite controversial, doctor. Let me warn you beforehand. So one person is asking that we got to know through social media that at the time of COVID, that people who took the vaccines, they are dying of heart attacks. Is that true? Is this the side effect?
This question is not controversial at all. We still have COVID-like antibodies in our blood. A study done very recently at the end of 2024 by Italian scientists has shown patients were divided into 3 categories. One who had an ICU treatment, 63 patients who had been to ICU, 30 patients, and rest of the patients, 17 patients. 17 patients were those who did suffer mild symptoms, and 27 or something like that were the patients who had not suffered at all. All the 3 groups have antibodies. And these were so new antibodies which we have not talked during COVID. They were not identified during COVID. And this was given a funny name also. And the property of these antibody was they bind all the clotting factors, they engage. So by all these test markers, when they get engaged, these test markers cannot be detected. So it is not that those people who have not suffered COVID, they did not have these antibodies. Now I'm coming to the answer. Post-COVID syndrome is being forgotten now. And COVID has produced damage to the endothelium, which I have purposely shown in my video. Post-COVID patients have got changes in the lungs, like I have in my lungs. 70% damage was there, now 30% residual damage. They are walking on the road and nobody is testing them. Nobody is following them. We are just blaming COVID vaccines. COVID vaccine deaths would have been many, many, many more in India if they were due to COVID vaccine. Now, the part of the answer. mRNA vaccines, which were used abroad, especially in US, have this property to cause these kind of antibodies. And that is why there were vaccine-related deaths. They were given compensation in UK also, and they were proven that mRNA vaccine caused deaths. Not in India, because in India, fortunately, we did not have mRNA vaccines. Our Covishield, Covaxin, and in some cases, the other vaccines in a small number, I would not name them for some reasons, they were safe. You had the COVID vaccine, I had the COVID vaccine, and our family members had COVID vaccine. We even had boosters in our family. And fine. You see, the shock of having COVID itself is a grave danger. Now the research is being done, what the COVID vaccine has caused, and I think it will take another 10 years to find out what COVID has done. But this was antibody, Adams antibodies. So these antibodies are being tested separately.
Got it. Got it.
And there is a different test to test these antibodies, but nobody is doing this. We are just making some fun out of talking COVID deaths. No, these are post-COVID deaths, not proven deaths by vaccine in India. I'm very particular in my answer.
Got it. Got it. Thank you so much for clarifying that. Actually, there's a lot of news on social media coverage generally, mostly, where people are talking about are these deaths due to the vaccine. But thank you for clarifying that. Another last question I feel, and something which is very, very helpful, very important, has been asked by Karambir Singh. He asked, what simple habits can we add to our daily routine to help with our blood pressure, to keep it in the healthy range? Daily habits.
What should?
Daily habits that can keep a check.
Daily habits, very easy. Blood pressure, see, it is a wrong name. Everybody for life should have a blood pressure to survive. What is wrong is high blood pressure. So don't let it go high. As simple as that. So blood pressure can become high because of these rare diseases which I have talked. If he has listened to that. This is only 5% cases. 95% we produce blood pressure by sleeping at wrong time, by eating wrong food, by eating more cholesterol-rich diet, by having alcohol intake, by anger, by not doing yoga, my last slide, and by smoking. So we are not born with blood pressure, mind it. There is nothing like congenital blood pressure. Blood pressure is always acquired, except for a rare congenital abnormality like renal artery stenosis or some rare condition. I had to purposely talk about these conditions because for doctors it is important to diagnose. For the patient it is important to know that they are happening in only 5%, less than 5% cases. Other than that, it is self-inflicted injury to the body. And most important answer to your question is exercise, exercise, exercise. I gave an example to for a doctor. I just talked about that doctor friend, and his medication is within 6 months of exercise, he is on zero medication. That means exercise is medicine for blood pressure. Yoga is a medicine for blood pressure. Right eating is a medicine for blood pressure. Quit smoking is a medicine for blood pressure. Enough regular sleep is a medicine for blood pressure. To de-stress yourself is a medicine for blood pressure. What else you want? If even then blood pressure is not controlled, come to us. We'll treat you. My statements will make many doctors unemployed. If the people start doing all these things, all the good habits, and quit all the good habits, like we treat Smoking is a good habit. Alcohol is a good habit. Energy drink is a good habit. Junk food is a good habit. Sofasan. I've not talked about sofasan. Sofasan means you are lying on a sofa, watching TV, watching computer, watching mobile. Plate of pizza on your right hand, plate of junk food is on the left hand, in your hand is mobile, and everything bedside. This is called sofasan. Stop this sofasan. Be active.
Yeah, that's amazing. That's amazing. That is a lesson, I think, for all of us to take, right, Jagan and Hiren. So I think also one more thing before we conclude, please avoid any sort of unmonitored dieting as well, because that can cause more harm to your system. Because our metabolism is so unique, it's so precious that we are destroying it by doing any sort of unmonitored dieting or,
Can I add one word to it?
Yeah.
If today a dish of your choice is made at your home, anybody's home, don't overeat it. Keep it for next day. Overeat it. That overeating should be after next 24 hours. So you have earned a meal. If you still like that, eat it on the third day. On first single shot, don't eat 3x meal. This is called overeating. So I don't say don't eat biryani for 3 days. Take it for 3 days, but don't take a 3 days dose of biryani in one meal. This is what is called overeating. Very good. Take the same food next day. Earn your meal. So I am not restricting the quantity you want to eat. I'm just spacing the quantity. And that is what Tweet program also does. You never say don't eat this. You color it red. When the red walks into yellow, you allow it. And sometimes later this red becomes yellow, yellow becomes green. This is the fun part of it. So you don't restrict things. You teach the client the discipline how to eat this.
Right, sir. I think that is absolutely insightful. And the personal experiences that you've shared, I think it's a lesson for all of us to, live our life a healthy way. Thank you so very much for joining us today, sir. And thank you for your time. Thank you so much, Sana, for being part of this. And we couldn't, thank you enough for the time that you've given with the insights that you've shared. Thank you, everyone.
Thank you, Hiren sir, and we wish all your team a great success. And Twin is a good name. Twin means you join together.
Yes, sir, absolutely.
So the doctor and patient, or programmer or the patient, or your advisor or the patient. So of course we make a twin.
Oh, absolutely. It's a winning partnership, sir.
Thank you.
Thank you so much, everyone, for joining, and have a good weekend. Thank you so much.
Bye.